Periodontal disease, also known as gum disease, can be classified in 3 different ways: mild, moderate, or severe, depending on the amount of bone loss around your teeth; localized or generalized, depending on whether most of your teeth or only a few are affected; and chronic or aggressive. Aggressive forms tend to happen early in life and progress quickly. Chronic forms happen later in life and tend to progress slowly. Periodontal disease is an inflammatory condition caused by bacteria. So 2 factors are important in the development of periodontal disease: bacteria and the host response or inflammation. Bacteria live in between your gum tissue and your teeth in periodontal pockets. The deeper the pocket, the more space there is for bacteria to live, and the less oxygen reaches underneath the gum tissue, leading to a favorable environment for fairly aggressive anaerobic bacteria which can live without oxygen. Periodontal pockets of 5 millimeters or higher tend to be a concern and usually should be treated. When pockets of 8 millimeters or more are present, it has to be evaluated closely whether the tooth needs to be removed. The bacteria around your teeth cause an inflammatory response in your gum tissue, since your body tries to fight off the harmful bacteria 24/7. This inflammation causes bleeding of the gums and eventually bone loss around your teeth, which creates deeper pockets, which creates more niches for bacteria, which creates more inflammation, which creates more bone loss, and on this downward spiral of periodontal disease goes until teeth become loose and need to be removed. This inflammatory response of your body to the bacteria is mainly genetically based. There are people who brush poorly and have abundant amounts of bacteria in their mouths, yet they never develop periodontal disease. This is because their bodies do not react in a destructive way. Others do an excellent job keeping their teeth clean, yet they develop rampant periodontal disease at an early age and start losing their teeth in their 20s. This is because their body reacts to the bacteria in an overly aggressive way, causing destructive inflammation. The way our bodies react to bacteria in our mouths is mainly genetically based. Therefore, whether you are highly susceptible to periodontal disease or not is mainly based on your genetics and your predisposition to periodontal disease. Since still today there is no way to change one's genetics, it is crucially important that those who are genetically predisposed to develop periodontal disease are aware of this early in their lives so they can take all measures possible to prevent early and aggressive progression of the condition. Treatment of periodontal disease is mainly based on reducing the amount of periodontal inflammation by reducing the amount of bacteria around your teeth. One of the most important factors for the success of periodontal treatment long-term will be your ability to keep your teeth as clean as possible. Therefore, I may ask you to meet with my dental hygienist several times so she can teach you how to most effectively keep bacteria away using the right tools and techniques. The first step of periodontal therapy is scaling and root planning, also known as a deep cleaning. A dental hygienist gives local anesthesia and cleans the pockets around your teeth with special instruments. You may be instructed to take antibiotics to help your body fight the bacteria around your teeth and to help change the bacterial composition to a more benign and less aggressive one. Please do not start the antibiotics until the day of your first deep cleaning. Scaling and root planning reduces the amount of bacteria around your teeth, hence reducing gum inflammation and preparing you for the next phase, periodontal regeneration surgery. Periodontal regeneration surgery has two main goals: pocket reduction and periodontal regeneration. Pocket reduction aims at reducing the depth of periodontal pockets around your teeth and hence the niches where bacteria can live and cause continued gum disease. Periodontal regeneration entails growing back bone around your teeth. This is done using bone grafts, bone regeneration membranes, and growth factors, but can only be done when bone defects look a specific way. I will not be able to determine whether a bone graft can be done until the surgery. Therefore, you may receive a separate treatment plan today which lists the cost for bone grafts, membranes, and growth factors to prepare you financially in case we need them. But please understand that we may or may not be able to actually perform these bone grafts. It is crucial for the long-term success of periodontal therapy that you will have periodontal maintenance cleanings every 3 months during and after treatment, alternating between your primary care dentist and our office. That way, you will have regular cleanings every 3 months while we can monitor your periodontal condition and your primary care dentist can evaluate any restorative treatment needs you may have. There are several factors contributing to the development and progression of periodontal disease. The most important factors are smoking and diabetes. If you are smoking, it will be crucially important for the success of periodontal treatment and for the prognosis of your remaining teeth that you quit smoking as soon as possible. If you have diabetes, it will be important to control your diabetes as best as possible. We will ask you on a regular basis what your A1C is to monitor whether your diabetes is well controlled or not. There is strong scientific evidence that your oral health is closely correlated to your systemic health. Poorly controlled periodontal disease puts you at increased risk for cardiovascular disease, such as heart attack or stroke, pregnancy complications, such as preterm low birth weight babies, and poorly controlled diabetes. If you suffer from diabetes, untreated periodontal disease makes it more difficult to control your A1C and vice versa. There is also growing evidence of the connection between periodontal disease and neurodegenerative conditions such as dementia or Alzheimer's disease. So, congratulations for taking the first step to a healthier mouth and a healthier body by visiting our office today.